All right, good afternoon. Welcome to today's electronic visit verification or EVV public meeting. It has been a while since we've had one of these public meetings, so welcome again to everyone who's attending. We do have quite a few of you on already. We'll wait just another second. I see a number of people still joining, so we'll just wait a little bit. Okay, so we wanted to come back together and share some reminders and updates related to EVV because, as I mentioned previously, before a bunch of you joined, it has been a few months since the last public meeting on EVV. A lot of the information contained in today's presentation is based on issues and questions that we have received or heard in the past several months. And it is based on the outreach either to DHS, to the PAC line, or through SANdata. So next slide, please. Some general housekeeping reminders. If you haven't joined one of these public meetings in the past, all phone lines are muted. Any questions should be submitted through the chat feature available to you. We will not be answering submitted questions during today's presentation, but questions will be addressed after the presentation through a listserv communication. We'll also post those questions and answers onto the website once they are available. And please reference the slide number, if applicable, when you submit your question to us through the chat feature. Next slide, please. So today's agenda is we're going to provide some general EVV reminders to folks. OMAP is going to share some reminders. We'll have some system implementation updates. We'll go through some frequent claims issues and resolution steps, and then we will reinforce those EVV contacts for everyone. Next slide, please. So general EVV reminders. EVV compliance requirements for personal care services were implemented on January 1st, 2021. All claims and encounters for personal care services subjected to EVV requirements for dates of service on or after January 1st, 2021 must have a corresponding electronic visit or claims payment will be impacted. You can reference the bulletins, EVV for personal care services, bulletin number 07-2004, 54-2004, 59-2004, 00-20-03, and EVV for personal care services provided for fee-for-service delivery system number 05-20-03 for additional details. I would note that these bulletins are linked on the DHS EVV website if you would like to find them there and review them again. So new EVV service providers, if you are a new EVV service provider or are just getting started with setting up EVV, providers interested in using the DHS EVV system must complete self-paced SANdata EVV training in order to use the system. The training may be accessed at the SANdata Learn link here. Make sure that the key name that's entered is that PA EVV agency in order to get to the correct training. Any alternate EVV system users must complete self-paced EVV aggregator training. That training can be accessed via the SANdata Learning Management System via the link that's featured here. That key name is PA Alt EVV to make sure that you are accessing the correct training there. And we have a slide or two just to make sure that you understand accessing that aggregator training, since we have seen a number of providers experience issues with that. DHS's EVV technical vendor, SANdata, will issue login credentials to access the DHS SANdata EVV system or the EVV aggregator once a provider completes either of those mandatory trainings. Next slide. As I mentioned, we are seeing some providers experience some issues in accessing the correct training, in particular the aggregator training. So if you've already used LMS, the learning management system, for the DHS SANdata EVV, then you may need to clear your cache and use the link in order to access the EVV aggregator training. Once you do that, you'll be redirected to the page that you can see on the screen, and you'll click the upper right login. You'll see that in green at the upper right-hand corner. Once you've done that, next slide, please. After selecting that green login in the upper right-hand corner, you should get the below pop-up message, and you will need to click Enroll in order to access the self-paced EVV aggregator training via LMS. I know it's a little small here, but you can see under that key name, it says PA Alt EVV, and that's what will get you to that aggregator training. So this is important for those users too who may have previously been using SANdata and are now switching to an Alt EVV. You know, just a reminder that you will need to take that aggregator training. Next slide, please. So providers, again, this is for new EVV service providers. If you are electing to use the department's SANdata EVV system, you must complete the self-paced training in order to receive credentials in order to use the system. And this is for OBRA, Act 150, and ODP and OMAP fee-for-service participants. Upon completing the self-paced training, providers will be issued a time-sensitive welcome kit, including their agency's production credentials. And providers must set up their agency and direct care workers in the EVV provider portal and train the rest of their staff on how to use the system, including the SANdata Mobile Connect application and telephonic visit verification, or TVV, visit capture modalities to their direct care workers. So that's really important to note. Next one. New EVV service providers electing to use alternate EVV, again, you'll need to receive credentials. The credentials are required for any provider using an EVV system that is not DHS SANdata EVV or HHA Exchange. The testing and credentialing process is an 8-step collaborative effort between SANdata, the provider, and the provider's alternate EVV vendor. That's really important to note that all three need to be part of that entire process. It makes it a much smoother and more efficient process. Providers and the provider's alternate EVV vendor are not considered certified until all 8 of those steps are completed. A quick reference guide that outlines those 8 steps for the alternate EVV certification process can be found on the DHS EVV website. And we've included the direct link to that website right there. Next slide, please. So the department will perform targeted outreach to providers that have either not submitted EVV data or have a high percentage of manual visits. You'll see that outreach. We've actually already started some of that outreach, and you'll see more of that in the coming months. For the aggregator account cleanup activity, we are currently assessing multiple unused accounts and will be communicating a decommissioning strategy in the future. So more to come on that. We also wanted to share with you that we do have some new provider resources. SANdata has developed a training video library. So in an effort to help agencies train employees that are using the SANdata system, or retrain employees and allow caregivers an opportunity to use an educational tool for the DHS SANdata EVV system. And again, this is for the SANdata system. SANdata has developed the training video library, and the link can be found here on this slide. The training library will not replace the SANdata learning management system that is required for users to actually obtain their system credentials. The library does have content covering an introduction to EVV, how to use telephonic visit verification, and how to use reporting functions with SANdata Mobile Connect. So this is exactly why we're saying that this library is going to be really helpful for your employees. And a final note on the EVV reminders, that the 21st Century Cures Act mandated that states implement EVV for home healthcare services by January 1st, 2023. The department is currently evaluating all Medicaid state plan and waiver services to determine which services are subject to these requirements. And we will issue a letter and subsequent listserv communications identifying the required services and the next steps in order to begin that implementation process. So while most of the information that we are sharing is, well, all of it today is related to personal care services, we did want to note that that implementation for home health care services is on the horizon. So just some OMAP reminders here. Next slide, please. Medical Assistance Bulletin 05-20-03, which we mentioned previously, titled Electronic Visit Verification for Personal Care Services Provided in the Fee-for-Service Delivery System, may be viewed at the following link. It is also available via the DHS EVV website. And of course, more information can be found on the department's EVV website, other than the bulletin itself. So activating new clients in DHS EVV, this is something that has come up a number of times, specifically with OMAP providers. By default, any new client will show in the DHS EVV provider portal with a status of pending. As a reminder, providers must confirm their clients by updating their status from pending to active. So they need to be switched to that active status. When you're in the Edit Client, you'll navigate to the Program tab, and then under the Client Status heading, the field Status is displayed. And I know that is a little bit small. The materials are available. You should see it as a handout if you would like to access it and see it a little bit better. Next slide, please. And this is just showing you that step again to switch from pending to active. Next slide, please. So for more details, providers using the DHS EVV solution should refer to the client module course in the Pennsylvania DHS Electronic Visit Verification Self-Paced Training for Agency Providers, and that is for the administrators. And then for all other staff, refer to EVV SANDATA Training Guide on DHS EVV webpage. They're specifically pages 53 through 60 of Section 245. And with that, I will turn this over to Kristen for the DHS system implementation updates.
Great, thank you, Britt, and good afternoon, everyone. My name is Kristen Weierman, and I am with the Office of Long-Term Living. I am going to start off our system implementation updates with a few different data measures that we've been using to monitor the EVV system functionality and our provider success. So this first table shows the rate that we're seeing each EVV-related error status code set for claims that have been submitted from April 1st to date. So you can see the breakouts for the Office of Long-Term Living, the Office of Developmental Programs, and the Office of Medical Assistance Programs. And please bear in mind, this data only reflects fee-for-service programs, not health choices and community health choices data. It is also important to keep in mind that a claim that set ESC 928 for EVV visit not found, or ESC 927 for the claims units exceeding the number verified by the EVV visit data, those claims could have been denied during the first week of April and then may have been subsequently corrected either through the visit data or the claim. And when that claim was rebilled, it would subsequently, hopefully, set ESC 925 and be verified in the following weeks. And I say that just to point out that that means that some of these claims could be counted twice. So if a claim was denied the first week of April and then rebilled and correctly paid the second week of April, some of those counts may show up in both columns here. But overall, we are seeing a dramatic improvement as we move through the year. And the next slide will really show the trends we're seeing. So next slide, please. Sorry, next slide, please. Thank you. So to kind of break down that last slide into more of a weekly trend for each program office, first here we have the Office of Developmental Programs, and you can see starting 1/1 of 21 and then moving through last week's claims, you can see the trends for the green bar, which shows those paid claims that found an EVV visit that supported the claim appropriately. And then you can see the blue bar for ESC 927, which means that the claim had more units than the available visit data supported, and that claim was denied. And then you see the ESC 928, which is that EVV visit not found, which either means there was no EVV visit data in the aggregator, or that means that the EVV visit data in the aggregator did not match the correct elements. So the service code was incorrect. Maybe the participant's MAID was incorrect. It could be any number of things. But you can see over time when you start really at 1/1 and you watch, especially that 928 percentage dramatically drops by the time you get to April to less than 10%. And that is absolutely fantastic. We're happy to see that trend continue. And we do hope to see all providers get to as close as 100% as is reasonably possible. And then you will see here, as you notice some of the kind of dips, I guess you could say, on the week of 2/22 and the week of 3/22. Those are two instances where we did notice some system related errors. And the great thing about these weekly reports, and the reason we're pulling them weekly, is it alerts us to things that may arise as problems that need corrected. And luckily, we did see those corrected pretty quickly, and that impact to those claims really did not stay consistent in the following weeks after that once the system was fixed. Next slide, please. And then here again, you see the Office of Long-Term Living fee-for-service programs, a bit more dramatic trending than we saw at the Office of Developmental Programs, but overall significant progress. And we are seeing, just as we are seeing with the Office of Developmental Programs, the most recent week, we're noticing less than 10% of those claims being denied, either for no visit found or for units exceeding on the claim compared to the EVV visit. So absolutely fantastic progress, and we appreciate all of your diligence as you've been adapting to the systems and also working through any issues you've been encountering. Next slide, please. And then again, for the Office of the Office of Medical Assistance Programs for those fee-for-service providers, that is definitely one of the smaller programs when it comes to the number of claims billed. So you can see those claims didn't really start rolling in until February. There's a bit of a different process there for prior authorizations and billing. So it did take a little bit longer, but we are also seeing that same positive trend shown through those other office slides, just in a bit shorter of a time period, but still fantastic progress as we look at the 412 to 418 code rates. And next slide, please. All right, thank you. So our next slide shows data related to visit exceptions that we're observing. And we're showing here about a month's worth of data. So this trend of visit exceptions that are setting starts from March 21st and then moves through April 18th. And some of the top reasons that we're seeing visit exceptions setting that require correction include missing service, the service not being authorized, the client may be unknown or the employee is unknown, the client ID may not match the phone, and we see visits oftentimes either without in calls, but more often without out calls. So more often than not, we are seeing that providers remember to clock in, but we are seeing that less often they remember to clock out. And so that's a great kind of resource. If you look at your, as your administrative staff make any of these corrections, if you're noticing any sort of visit exception trends that are consistently requiring correction, that may point to a great opportunity to offer training to staff who may be struggling to either remember at the end of the day to clock out or remember to appropriately select the correct service being provided from the list. So please just keep an eye on these, and hopefully over time we'll see these fall as everyone gets used to the systems. So next slide, please. So as you continue to monitor and correct any of these visit exceptions that you may be seeing in your systems, please note that exceptions for Pennsylvania DHS programs should only be setting for the reasons that we've listed on the slide. So those things include invalid service, a missing service, unknown client, unknown employee, unmatched client ID or phone, visit without in calls, or visit without out calls. And we note this because in the past we have seen some unexpected exceptions populating that are unnecessary for the Pennsylvania program. And we implemented these exceptions to, at a minimum, ensure that all required data elements were included in the visit, but we tried to keep those exceptions to that minimum to hopefully decrease administrative burden for provider agencies. So that being said, if you are seeing exceptions that are not on this list, please report them to the appropriate contact on the screen based on whether you're using the DHS SAN data system or you are using the PA Alt EVV system. And that will help us to ensure that we can correct whatever is causing those unnecessary exceptions to set, and you will not have to continue to correct them unnecessarily in the future. Our goal is to really just use these exceptions to make sure the data is valid, but not have so many exceptions that create unnecessary burden. Next slide, please. So the last couple updates I'm going to cover are in regards to some specific system issues that we've seen, as well as a few upcoming changes. So first, for some agencies serving Office of Developmental Program waiver participants, you may have encountered some rejections between the dates of March 16th and April 6th. So providers who are using an alternate EVV vendor and that encountered these error transactions should please resubmit all impacted visits and resubmit all impacted claims as this has been corrected. And hopefully this is not news. We did also update and include an RA banner in Promise I think last week that populated to alert providers that this had been corrected and you could begin rebilling. But if you have not begun resubmitting that data, please do so as that issue has been resolved. And we appreciate your patience with that system interruption. Next slide, please. So then we do have two other items that we know have been presenting some challenges to some providers. So the first is in regards to some challenges being encountered when using the last 5 digits of the Social Security number as an employee ID. And we are actively testing options to address the duplicate ID rejections that some providers are encountering. And we do hope to issue an update in the near future about how we will resolve that for any providers that are currently encountering that issue. If you are encountering that issue, and you have not yet opened a ticket, please do so so we can ensure that we have that information and get that update to you as soon as possible. Then for the physical health managed care or the health choices providers, the Office of Medical Assistance Programs continues to evaluate rounding rule options and how the MCO systems will be programmed to appropriately calculate time. So we do hope to also issue updates in the near future, and those updates may come from the Office of Medical Assistance Programs, or they may come from the managed care organization directly to your agency, but we do hope to have an update on that in the near future. Next slide, please. All right, and then the last update we wanted to provide was just in regards to the DHS SANDATA EVV billing module. So for any provider who selected to use that DHS SANDATA EVV system for their fee-for-service lines of business, you will have the opportunity to use the billing module as soon as it is live and functional. We are continuing testing and doing our best to make sure that this billing system works as appropriately and as seamlessly as possible for all providers. And we want to make sure that it integrates appropriately with the Promise system so you don't encounter any sort of billing interruptions. So we do continue to test that and hope to have additional updates in the near future. When that is live, you will be directed to take the recommended scheduling and billing training in the DHS SANDATA LMS system if you have not already. And I think with that, next slide, please. I think I'll hand that off to Jen Grimm for some claims resolution items.
Thank you, Kristen. So I'm like Kristen said, I'm Jen Grimm with the Office of Developmental Programs, and I'll be covering some claim issues that we're seeing and some recommended resolution steps to take for those. Next slide, please. As most of you should already be aware of, the error status codes that are associated with the EVV are actively setting for the fee-for-service programs. And we encourage you to actively review those ESCs, especially 927 and 928, to determine if your claims in the data are matching appropriately to minimize any impact to your payment. Just a reminder that there is an EVV ESC guide that is on the DHS EVV website, and it basically, identifies the different ESCs. There are more ESCs that are associated with EVV, just the ones that have a payment impact are the 927 and the 928. So we encourage you to review that resource that's out on the website and to identify the different scenarios that could cause those ESCs to set, and resolution recommendations are also contained in that. And we'll be going through that through the next slides, taking a little bit of a deep dive into the reasons why these ESCs set. 927 is fairly cut and dry. The name for ESC that's associated with that edit setting is the units billed exceed units verified in EVV. Essentially, if there are not enough units in the EVV aggregator versus what was submitted on the claim, this ESC will set. It will also set if you submitted a claim and you made an adjustment to a record that's already in the aggregator, but your claim does not reflect the units that have been adjusted in the aggregator. Again, there would be insufficient units in that case in the aggregator to match what's on the claim, to either match or be greater than what's on the claim. If your units, you have to kind of look in the aggregator and look on your claim, determine from a resolution perspective, determine which one's accurate, which one is not. If your units are not accurate in the aggregator, then you'll need to go back to your source system or the DHS EVV system, maybe adjust the time if that's what had occurred, and ensure and resubmit your claim, ensuring that the units that are on that claim either match or are less than what it is in the aggregator. Next slide, please. All right, ESC 928, there are a lot of reasons that ESC 928 would set. One of them is pretty cut and dry. It's the visit is not found. So visit not found, I don't want you to think visit not found is just because the visit's not there, not present in the aggregator. It could set for a whole bunch of reasons, and we're going to go over what those reasons are. The main reason, I mean, one of the reasons is it literally, the visit, there is no visit in the aggregator, like literally no visit there. So you want to go into the aggregator, go into visit review screen, look up, and we'll go through that. We have screenshots to go into the aggregator and the steps that we recommend you take. Go in there, do a search. And if nothing pops up, I mean, there is no visit there. And what you would do in that situation, if you're using an alternate EVV vendor, you would have to, connect with them, ensure that that data is submitted to the aggregator before the claim is submitted. Because we're finding that folks may submit a claim before validating that the visit itself is in the aggregator. And in those situations, I mean, the visit actually is not there when the claim is submitted. And it could be during the same day. You submit your claim at 12 o'clock, but then your aggregator EVV record went in at 2 in the afternoon. So in that instance, that would set 928 and would deny the claim detail line for that particular service. So yeah, we encourage you to go into the aggregator, and confirm that the records are in there that you are submitting on the claim. Another common reason is that the visit record in the aggregator is not in what is called a verified status. And later I'll show you what that looks like because we have a screenshot. So the record essentially in the aggregator must be in a verified or processed status, or it basically is, I don't want to say invisible, but when the call gets made to validate against the aggregator, if it is not in either a verified or processed status, it basically isn't visible, so to speak. So, and it will set 928 and your claim detail line will deny. So again, go in there, ensure it says verified. If it doesn't say verified, look at what error set, make that correction, either in your source system if you're an alternate EVV vendor, or the DHS solution, if that's what you're using. Then you would ensure that the record is resubmitted into the aggregator before resubmitting your claim. Next slide, please. Oh, screenshots. So this is, we just wanted to illustrate what we just talked about before. So you'll see this is a claim, part of a claim that's submitted for an EVV service. And the data it's fairly small, so I'm not sure if everyone can see it, but hopefully if you can't, you can always review back when, after the meeting, because there is a downloadable version attached to this meeting. So you'll see the data service is the 14th. I believe that's in home and community supports. There's 59 units on the claim. Can you go to the next slide, please? Okay, so essentially 928 set because literally there was no visit found. So you'll see a search was done, and this is a screenshot of the aggregator and or what folks see who use the DHS solution. So basically what's set here, the 928 set, because literally there are no records that match what was on that claim that we saw on the previous slide. So that you'll see the dates of service here. You'll see that visit, always set your visit status to all, and no results were returned. So therefore it's set accurately, and set as expected. So in this instance, you would, resubmit. I shouldn't say resubmit because it wasn't even submitted to begin with. You would submit an EVV record for that particular claim, then validate that it's in the aggregator, and then resubmit your claim. Next slide, please. Okay, another example. We have a service March 11th, 2021. 14 units were submitted on this claim. Next slide, please. Next slide, please. I still see the, oh, thank you. Okay, so 928 set for that particular claim that we saw on the previous slide. And this is an example of in the aggregator, what the aggregator will look like when the visit status is not verified, not in a verified status. So you'll see squared out in red here, you'll see the word incomplete. The next line also shows incomplete. So basically an exception is associated with that particular visit. So a correction would need to be made by the user. And once that correction is made and you have validated it in the aggregator, then you would resubmit your claim at that point in order for it to pass EVV validation. Next slide, please. Okay, so if you did step one and your visit isn't, and your visit's not missing, your visit's there, it's in the incorrect status, you made those corrections. If you're still experiencing another reason it would set is there could be a mismatch between what is on the claim versus what is stored in the EVV record in the aggregator. So some of those data fields that could be quote unquote mismatched could be the data service, like the data service on the claim could be different than the data service on the record. The procedure code is another reason. The recipient ID number, which is a 10-digit Medicaid ID. If you have a 9-digit Medicaid ID, which we call an MCI in the aggregator, and you're submitting a 10-digit Medicaid ID, this ESC would set. And therefore, the aggregator record would need to be corrected with the 10-digit Medicaid ID in order for the claim in the aggregator to match. Another reason could be that the provider account associated with the provider ID is also not matching. Okay, and again, with any of these resolution steps, you want to identify the error, correct the error. If you're using an alternate EVV vendor, resubmit that record back to the aggregator, then resubmit your claim. That's kind of standard practice with making any corrections. Next slide, please. Thank you. Okay, so you tried that. That's not the problem. Another reason that ESC 928 could set is because there are no duplicate. Yes. Another reason it could set is due to duplicate visits. So, which means, 2 or more visits are found in the aggregator when the claim validation call against the EVV system is made. And what essentially happens is the system gets confused. It doesn't know which one to pick. Therefore, we have to get rid of anything that's a duplicate or more than one record that has the same data elements. So you may need to, obviously, you're going to have, you could either, it could be that if there's two records, one of the records could just be inaccurate. So you need to really take a look, go into the aggregator, take a look at what those records are, see if perhaps one of the data elements really needs to be adjusted, and that would take away the duplication. And if that's the case, again, if that removes the duplication, I would validate that and then resubmit the claim. So if they truly are duplicates and no adjustment needs to be made, then if you are an alternate EVV system user, to omit the duplicate, you would, there's the bill visit indicator, and it should be set to false. And this really tells the system to disregard this particular record, so it sort of becomes invisible, so to speak, in a sense, once that happens. And the visit status, you will notice, if you go into the aggregator, you will notice when you do this, that it is set to omit. The correct visit, obviously, will need to be resent using the visit other ID provided by the alternate EVV system. Next slide, please. Okay, more. So again, this is an illustration of a screenshot of a claim. January, I can't really even see that. I'm going to say January 18th is the date of service. Got 7 units. I believe that's in-home and community supports. Next slide, please. Okay, so this is a screenshot of an example that shows the duplicate. Again, it's a little miniature, but just trust me, they're both the same here, and they're just showing what you would see as a user if you went into the aggregator and when you're assessing whether or not a duplicate record scenario has taken place. This is an example of what you would see. So see the little boxes there. You would want, if you're in the Sandata system, you would want to check those boxes. Or one box, I should say, because you kind of just want to get rid of one, so there's no duplicate there. Then validate that it was removed, then resubmit the claim. Next slide, please. So you go through all that. There's no duplicates. The record's not missing. It's in a verified status. The one thing, if you went through all of that and you're still setting 928, you really need to connect with your alternate. If you're an alternate EVV user, you want to connect with your alternate EVV vendor and ask them whether or not they've received an error file, because that error file, more times than not, will let you all know what failed, so that you can go ahead and correct that failure and then resubmit the record to the aggregator, then resubmit the claim. Again, if any visits are missing, you may need to resubmit an alternate EVV visit record. And in some instances, you may need to actually manually enter the visit if it's missing. Oh, thank you. Again, illustration, we got a service that was rendered on the 30th of January. 5 units are being submitted. That's probably 5 15-minute units for that particular service. So again, this is a claim example, and we're going to show you it's the record associated with it in the aggregator. So, okay, so on the last slide, you had seen that the record was submitted on the 30th. Oh, I'm sorry. It was submitted 4 dates of service. That was the 30th. So after doing a search in the aggregator, you'll see here that the reason that ESC 928 set is that record is not, well, there is a record here for the service that's on the claim. However, it's the visit date is different, which means the data service that's reflected in the aggregator is not matching what is on the claim. So either the claim needs to be resubmitted with the appropriate date, or the record could be missing because we're not seeing it here, or this could be wrong, this particular record that's in there, and may need adjusted. Next slide, please. So if you did all that and you're still setting ESC 928, we have contact information here. So you really want to contact the appropriate support team. That's one of these two bullets here, to begin resolving the issue. And here is the alternate EVV agency support, team support, and the email address is here. The phone number 855-705-2407. And also the DHS EVV agencies. There's the Provider Assistance Center, and the email is listed here, and their phone number, 800-248-2152. It's really important when you reach out to any help or support line that you are very specific with the issue that you're encountering and provide as much detail as possible. We certainly encourage screenshots and secure screenshots to be shared with the support teams so that they can replicate your problem and see what your problem is and do the appropriate research so they can come up with a resolution and assist you with resolving and ensuring that you are not denied anymore. Again, providers using an alternate EVV system should keep in regular contact with their EVV vendors and consult with vendors when questions arise regarding your data. It's really important that that line of communication is occurring. Again, we have found providers reach out to us and we ask them, have you connected with your alternate EVV vendor? And they've said no. And it's really important because they are seeing things at their end that may have an impact on what you're seeing at your end. So it's important to really connect with them and see if they already have identified an issue, or at least pointing it out to them so corrections can be made. And also, if you're going to be reaching out to SANDATA, it's important to, via email, to CC and include your alternate EVV vendor on that outreach activity so that they are aware of issues that are going on and the status of those issues in terms of reconciling or resolving those issues. Next slide, please. Again, so to summarize, to validate if your visits are verified or need corrections, the DHS aggregator user should be checking the DHS aggregator to ensure completed visits are in verified status. So yeah, another reminder, very important, check that status. That was one of the first steps we had outlined for you earlier. Claims will fail EVV validation if that EVV visit in the aggregator is not in a verified status. It can also be in a process status as well. So it's verified or process status. So DHS SANDATA EVV users, they will need to check the DHS SANDATA EVV system, while the alternate EVV users would use the aggregator. HHA Exchange users should validate visits in HHA Exchange. So if your agency is using a combination, because there are some agencies we're aware of that use a combination of these, then you will need to check all of those source systems regularly. Yeah, by the way, reminder, DHS aggregator is read-only. You can't make changes in the aggregator. The changes need to be made in the source EVV system, either the DHS EVV system, or if you're using an alternate EVV solution, you would make those changes in that system, and then they would be, resubmitted back to the aggregator. Here's some reminders. When you go into the aggregator, ensure that your filter, you'll see it circled here. I don't know if you can really, it's miniature size, but you want to filter on all visits. And just to show you where the verified status is located in the aggregator, it's under the visit status column that's circled here in red, where the arrow is pointing. Again, if the visit status shows incomplete, which I believe it does on this screen. Yeah, if it shows incomplete, that should trigger you to research further, identify what those issues are, make those corrections, and ensure that the visit status is updated to verified. Next slide, please. Okay, so if it does show verified, if the visit status does show verified, which it does in this screenshot, then, I mean, you don't really need to make updates and corrections to the visit. Not necessarily for the status, that is. I mean, if you assess that the visit was captured incorrectly or something's incorrect, obviously on it, you would make a manual update, but, oh, okay. I'm going to pass it to Britt now. Thank you.
Thanks, Jen. So just to wrap things up, we wanted to go over the contacts once again. I know this has been shared out in previous public meetings, and some of this information is already available on the DHS EVV website as well. But for technical issues, and those, when we're talking about technical issues, we're referring to things like DHS SANDATA account assistance, welcome kit reissuance, account unlock issues, either for a DHS SANDATA EVV. Please provide the PAC, or Provider Assistance Center, and that's papac1@dxc.com, or that 800 number. For issues related to alternate EVV systems, that is such as account unlock issues for the DHS aggregator portal, integration status inquiries, or issues with the DHS aggregator accepting file submissions, you want to contact the SANDATA Alt EVV support team, and that's PAalteVV@sandata.com, or their 855 number included here. For issues related to HHA Exchange and CHC billing, you need to contact HHA Exchange, and their email is included here, and or the appropriate CHC MCO. Vendors needing to integrate with the CHC MCO HHA Exchange should contact the email paintegration@hhaexchange.com. For issues related to PHMCO claims and billing questions, please contact the appropriate PHMCO, or Physical Health Managed Care Organization. Next slide, please. For general EVV program issues or requests to be added to the EVV listserv, you can reach out to the EVV resource account, and that is ra-pwevvnotice@pa.gov. Providers with technical issues reaching out to PAC or SANDATA alternate EVV team may copy DHS on a newly created resource account, and that is for specifically those technical issues that you're experiencing, and that's ra-pwevvissues@pa.gov. That account is monitored on a daily basis by a bunch of our EVV support team. So we will be looking for the issues that you are experiencing, and it makes us aware of the issues that are occurring on the technical side. Providers with support ticket numbers that you wish to escalate with the department should also reach out to that newly created resource account. And again, it's ra-pwevvissues@pa.gov. So it's really important that you have that ticket number and you share that in the email outreach that you do to EVV issues. For billing issues, such as why EVV ESCs are setting, what the EVV ESCs mean, questions about what is in the aggregator, you want to contact the program office claims numbers and emails included here. Next slide, please. I apologize, the dog's got a little rowdy here. Just general reminders when you're contacting support that your alternate EVV vendors may not understand your specific agency processes. So you want to be as detailed and descriptive as possible so that our support teams understand your issue. And always, 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 screenshots are helpful when you are experiencing an issue to show exactly what you are seeing versus what we are seeing on our side. Again, if you have specific examples or screenshots, you need to send them via secured or encrypted email due to PHI or PII. We did have a question about those that do not have the ability to send secure data. If you are unable to send that, please request a secure email, or via SANdata, you can request a send safely link, and then you'll be able to send your data in a secure manner. If a provider is working with an alternate EVV vendor and has a ticket number, please provide that ticket number. And check your spam folders regularly for emails from DHS, SANdata, HHA Exchange, or other approved listservs, programs, or agencies for updates. And in general, ticket submission requests due to technical errors arising in the SANdata system or the aggregator must have sufficient evidence for tickets to be created and resolved efficiently. When you are reaching out, please supply the following information to the appropriate contact based upon your issue. And that is the specific issue with details about what is occurring, a quality image of the error, that is a screenshot of what you're seeing occur, as well as any additional details that could help us in really looking into what the issue is. Please detail the steps that you've taken that generated that error. And then, of course, your complete contact information, including the provider name, your Medicaid ID, the STX number, your contact name, email, and direct phone number. All that information really helps us in really rooting out what the issue is and hopefully solving the problem. So with that, we're going to wrap things up. We want to thank you so much for joining us today. Additional public meetings will be scheduled in the future. We're looking at a quarterly schedule for these meetings. Of course, once we have those dates available, we will post them to the website and we'll issue a listserv communication with those dates and how you can register for those. We will be sending out the materials from today's session through a listserv communication, and we'll also follow up with a question and answer document based on what has been submitted today. The materials will also be posted to our DHS EVV website, and I think that's everything for today. Again, we want to thank you, and we'll look forward to speaking with you again in the future.